Hello, I'm Dr. Enes Datta. Today, my topic of discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, high blood pressure, blood pressure is defined as the lateral pressure exerted by blood while flowing through the blood vessels. Uh, there are two types of blood pressure. One is systolic, one is diastolic. So while measuring blood pressure, we generally say, suppose 130 by 85. Here, the pressure 130 is the systolic part and 85 is the diastolic part. Now, what is systolic blood pressure? Systolic blood pressure is the pressure exerted by heart on the blood vessels while it contracts. And diastolic blood pressure is the blood pressure exerted by the heart while it rests between two beats. Now, what is the normal blood pressure then? Normal blood pressure is around 120 by 80 systolic by diastolic millimeter of mercury. Uh, there are risk factors that can increase the risk of developing high blood pressure, which is called hypertension. These are age. As people get older, arteries stiffen up and narrow, and excess fat builds up in the arteries, and this causes the blood pressure to get high. If there is a family history of high blood pressure, if one or more family members have got high blood pressure, then the person has a tendency to develop blood pressure high. Excess salt intake is also one of the factors that raises the blood pressure. Not eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney diseases. Eating processed food and fatty foods increase fats throughout the body and make the patient obese, and this, on the other hand, increases the blood pressure. Another one is stress. Reacting to stress in unhealthy ways or not managing stress properly can lead to high blood pressure. Now, high blood pressure usually develops over some time. It can happen because of unhealthy lifestyle choices. For example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress, as already I have mentioned. Moving on, hypertension does not have any obvious signs and symptoms. That is why it is often called silent killer. It, it puts people at risk for several diseases from cardiovascular problems to kidney failure, stroke, eye damage, and even blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way by which we can get the proper picture of blood pressure. Now, how is this blood pressure measured? Blood pressure is measured by a simple method, by a simple instrument called the sphygmomanometer. Sphygmomanometer records both the systolic and the diastolic blood pressure. Generally, when symptoms do occur, they include morning headaches, tiredness, vision changes, buzzing in the ears, dizziness, fatigue, nausea, and vomiting. If person is experiencing some of these symptoms, then blood pressure should be immediately measured. If blood pressure level is or more than 140 by 90 millimeter of mercury, then the person is said to have hypertension. If the person have BP levels higher than this, then he or she might at risk of developing serious heart diseases and other complications. The risk can be prevented and reduced by taking some steps towards a healthier lifestyle, such as regular exercise, healthy diet, quitting smoking and reducing alcohol intake, regular blood pressure monitoring, stress management, and adherence to medicine. Now, let us take one by one. Uh, Regular physical activity is the cornerstone of developing a normotension or lowering blood pressure. Exercise can be a drug-free approach to lowering high blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less, uh, or if heart has to work less to pump blood, then the blood pressure naturally comes down. In other case, as we are all aware that the age and weight gain are the two major risk factors for high BP. So if the blood pressure is not in desired level, that is 120 by 80, the exercise can help prevent it from rising as you age. Besides this, there is healthy diet, which is called DASH diet. Uh, then quitting smoking, as I've already mentioned, regular blood pressure monitoring. These factors all help in reducing the blood pressure levels. Stress management is another uh, serious issue. If a person manages stress properly, blood pressure can be reduced. And the last of all is adherence to medicine. Once blood pressure lowering medicines has started, it should be taken regularly and uniformly. This helps to decrease the blood pressure and keep the person healthy and fit.